Hey everybody, we are live. I am at YPS and I'm about to undergo a treatment with my esthetician Monica, one of my estheticians, and it's called Intense Pulse Light or IPL. You can go ahead and get started. I'll just talk while you do stuff. Although if my mouth is moving and you want me to stop moving, then just slap me or something.
Alright.
So IPL is short for Intense Pulse Light, and it's a light-based device that can target dark spots. Another name for it is the photofacial. And so what we're going to do is we're going to target a lot of the dark spots on my face. They're typically called age spots or sunspots. We get them due to sun damage. It's the pigment that can develop, kind of like irregular pigment deposition. And unfortunately, you can't get rid of them unless you actively remove them. Some ways to actively remove them are to use lightening creams. You can buy some over the counter, ones that contain niacinamide. Very slow acting, but they do work to lighten dark spots. You can also do kojic acid, which we have in our Youn Beauty Brightening Cream. Very safe. A more aggressive approach with creams is hydroquinone. Hydroquinone can be purchased in prescription strength, and that can really affect the melanin of your skin to lighten it and smooth things out. And what I usually recommend is to combine a good lightening or brightening cream with IPL treatments like we're going to do today. So this is my second one. I think we did, what, about a month ago, Monica?
About a month, yeah. 5 weeks.
Yeah, so we're going to do another one to get rid of more dark spots, and so feel free to watch. It's not a painful procedure. You may see me flinch a tiny bit. Okay. But in general, it's quite easy to tolerate. And you'll see it's kind of this bright light. So what it just does is it will take these dark spots and make them darker and to help lift them up. And in about a week or so, some of these dark spots are actually going to be darker and slough off. And we do recommend several treatments. How many do you usually see for optimal results, Monica?
We like to say at least 3.
Yeah, and we space them out a good 3-4 weeks apart. For me, it's maybe 5 just because I've been so busy. And feel free if you want to ask any questions about this treatment or other related treatments. Karen's got the phone here, and she can try to answer them, or try to ask me while I'm having this done.
We have one that might be answerable. Will this help rosacea?
This is not typically considered a good treatment for rosacea. Rosacea is more of a red color, and so this targets more brown. I'm definitely feeling this. Could you use a touch more of the gel?
Sure.
Anyway, so this is more of a brown versus red. If you do have rosacea, one treatment for rosacea is pulse dye laser. And we do have that here at YPS, and that specifically targets the red color of rosacea. Another interesting treatment for rosacea lately is an anti-parasitic. And, oh gosh, what's the name of it? I'm blanking on the name all of a sudden. But that's also another, it's just a cream that has been used lately for rosacea because there is a thought that if you can get overgrowth of a certain mite on the skin, that can actually potentially be a contributing cause of rosacea. And if I remember the name of the cream, if it comes back to me, I'll let you know.
We have another question. Does IPL help wrinkles, and what if you use it with RF?
So this IPL actually does have RF in it. So this is the ELO system from Syneron Candela. And the idea is that the RF will get you a better result and will also contribute to some skin tightening as well. So yeah, definitely you can get some other effects with it. It's mainly for dark spots, but you can get the benefit of getting some mild skin tightening too.
And what about with large pores? Will it help?
Unfortunately, the pore size, that's a really hard thing to treat. And we don't have a great treatment for pore size. probably won't do a whole lot for it. The idea behind pores and large pores is that they're genetically mediated, so you can't just switch large pores to small pores, but if you keep the pores clean, they may be less visible. We're going to be starting a new treatment here called the Gold Filtox Facial, where we combine microneedling with Botox very superficially injected and filler very, very superficially injected using microneedles. And that's something we're going to be watching is the change in pore size with those. So you can see we've got two different things. There's the cooling mechanism that's on the handpiece, so it feels really cold. And she's using this gel. The gel is to help get a better treatment, a better coupling, and prevent it from sparking or creating any type of a burn situation. And I'm going to stop talking a little bit when she gets closer to the mouth area, because I don't want her to have to hit a moving target. See the lights there, Karen?
Mm-hmm.
This is probably one of the most popular treatments here at YPS. Because so many of us have dark spots.
Can you describe what it feels like?
It's a little bit of a snapping sensation, kind of like a very small rubber band snapping at your skin. It's definitely well tolerated. You may feel a slight stinging at the time. And we typically don't need any type of topical lidocaine or anything like that for this treatment.
Somebody asked if it helps with age spots, which obviously it does, correct?
Yes, and the other thing you need to be careful with is if you're a male and you're having this done and you pride yourself on your beard, that could be an issue because it's the same a similar type of laser that can even reduce, permanently reduce hair. Now, as you can see, I don't have a ton of facial hair, so probably not a big issue for me. I've never been able to grow a whole lot out, enough to make it look kind of scruffy and not so good. So my wife hates it when I don't shave.
Can you use it just for the
gross.
face or other parts of the body?
That's a great question. We actually use IPL for all parts of the body. Faces being most common. Second most common is probably the neck and the décolletage, the upper chest area. And then the third most common would be hands. So many of us, we have the dark spots on our hands. It can be improved with this. And it's very common that people find after starting treatments like this, taking good care of their skin, eating right, that the skin of their face starts to really look nice. And then they look at their hands and their chest and they say, well, geez, I want to make those areas look like these. And they move those treatments down to those parts of the body too. You see that, don't you, Monica?
Oh yeah, especially after 2 or 3 treatments, if they have the package and they're really happy with the result, then they're like, hey, let's try it on the chest now and see what we can do there.
Yeah, the chest and the hands are 2 of the most neglected body parts. And so it's nice to see those nice changes for them.
And what does this treatment cost here at YPS?
What is it, $300 a treatment?
$300 for the face.
And we have package prices, so if you sign up for a package, I think it's buy 4, get 1 free? Something like that.
For the IPL, it's buy 3 and your 4th is free.
Okay. See, it shows how much I know.
He just works here.
So just a slight snapping sensation. All right. I think that's pretty good. I appreciate you guys all watching. And feel free, if you have any questions, to leave it behind. We'll do our best to answer them. Otherwise, thank you so much for watching, everybody. Next time you see me, I'm going to have absolutely no spots on my face at all. All right, thanks, everybody. Have a great day.